Hello and welcome. Today we're diving into a rare but important heart condition called double chambered right ventricle, or DCRV. We'll explore what it is, why it happens, how it's diagnosed, and what treatment options are available. The exact cause of double chambered right ventricle isn't fully understood, but it's considered a congenital heart defect. This means it's present at birth. It develops during fetal development when the heart is forming. A muscular or fibrous band, or sometimes both, abnormally divides the right ventricle into two chambers. Genetic factors may play a role, but specific genes haven't been definitively identified. Let's visualize what's happening inside the heart. Normally, the right ventricle receives deoxygenated blood from the right atrium and pumps it through the pulmonary valve into the pulmonary artery, which leads to the lungs. In DCRV, the abnormal band obstructs blood flow within the right ventricle. This creates a high-pressure chamber proximal to the obstruction and a lower-pressure chamber distal to it. The obstruction increases the workload of the right ventricle, causing it to hypertrophy, or thicken. Over time, this increased workload can lead to right ventricular failure and increased pressure in the pulmonary artery, a condition called pulmonary hypertension. Double-chambered right ventricle is a relatively rare heart defect. It accounts for a small percentage of all congenital heart diseases. Precise epidemiological data is limited due to its rarity, but is believed to occur in less than 1% of individuals with congenital heart disease. It can occur in isolation or in association with other congenital heart defects. The signs and symptoms of DCRV can vary depending on the severity of the obstruction. Some individuals may have no symptoms, especially if the obstruction is mild. However, as the obstruction worsens, symptoms may develop. These can include shortness of breath, especially during exercise, fatigue, chest pain, a heart murmur, which a doctor can hear with a stethoscope, cyanosis, a bluish discoloration of the skin due to low oxygen levels, and failure to thrive in infants. Diagnosing DCRV typically involves a combination of methods. A physical exam, including listening to the heart for murmurs, is the first step. An electrocardiogram, or ECG, can assess the heart's electrical activity. An echocardiogram, which uses ultrasound waves to create images of the heart, is crucial for visualizing the obstruction and assessing the right ventricle's size and function. Cardiac catheterization, an invasive procedure, may be performed to measure pressures in the heart chambers and assess the severity of the obstruction. MRI may be used to define the anatomy of the right ventricle in detail. While there aren't specific types of DCRV, the condition is generally classified based on the location and severity of the obstruction. The obstruction can be muscular, fibrous, or a combination of both. The severity ranges from mild, where there's little to no obstruction, to severe, where there's significant obstruction to blood flow. The primary treatment for DCRV is surgical correction. The goal of surgery is to remove the obstructing band and create a normal flow pathway within the right ventricle. The procedure is typically performed through open heart approach. In some cases, minimally invasive techniques may be possible. For mild cases without significant symptoms, close monitoring may be the initial approach. Medications, such as diuretics, may be used to manage symptoms of heart failure until surgery is performed. Unfortunately, there's no known way to prevent DCRV because it is a congenital heart defect that arises during fetal development. However, women planning to become pregnant can reduce the overall risk of congenital heart defects by maintaining a healthy lifestyle, avoiding smoking and alcohol, and ensuring adequate folic acid intake. The prognosis for individuals with DCRV is generally good after surgical correction. Most patients experience significant improvement in symptoms and quality of life. However, long-term follow-up is essential to monitor for potential complications, such as right ventricular dysfunction or pulmonary hypertension. Research is ongoing to better understand the genetic factors involved in DCRV and to develop less invasive surgical techniques. Studies are also focused on improving the long-term outcomes for patients after surgical repair. The precise management of pulmonary hypertension is constantly being investigated and may involve novel targeted therapy. Thank you for joining us on this exploration of double-chambered right ventricle.